Our dear students, welcome. We are glad that you are here, and this is the anatomy course. In the general principle module, we are going to discuss in this lecture anatomical terminology, skin and fascia by me, Dr. Asma Azam, lecturer of anatomy and embryology. Chapter 1, Anatomical Terminology. We will start by defining anatomy as a science. Anatomy, it is the science that describes the different parts of the human body by using dissection. The human body is composed of small units called cells. These cells collect together to form tissue, which subsequently create organs. Anatomy is subdivided into histological or microanatomy, gross or macroanatomy, and other subdivisions like radiological anatomy, surgical anatomy, surface anatomy, applied or clinical anatomy, and embryology or developmental anatomy. Embryology describes the different stages of the human during intrauterine life or during being and growing early in the mother's uterus. Gross or macroanatomy comprises the following categories: regional anatomy, general anatomy, and systemic anatomy. Regional anatomy describes a definite region of the body that contains some organs having the same location. For example, to study the anatomy in the form of head and neck region, upper limb region, thorax, abdomen, and so on. General anatomy to describe certain structures that lie in every region of the body, such as skin, fascia, bones, or blood. Systemic anatomy is to describe the human body in the form of systems. For example, respiratory system, cardiovascular system, urinary system, or nervous system. We will discuss some types of terms, such as terms related to position, terms related to direction, and terms related to movement. Terms related to position. We will start with definition of the anatomical position. It is the position in which the body parts are placed in the following situations. The body is standing in erect position. Palms of the hands and eyes are looking directly forward. Arms are beside the trunk and legs are close together. To study different parts of the human body, imaginary planes running across these segments can be done. They are either vertical planes or horizontal planes. Vertical planes are subdivided into sagittal planes and coronal planes. In this diagram, vertical planes include sagittal planes and coronal planes. Sagittal planes divide the segment or the part into right and left halves, and if they are equally divided into right and left halves, it's called median plane. Any plane parallel to the median, it's called paramedian plane. Regarding the coronal plane, the part or the segment is divided into anterior and posterior segments, while in horizontal or transverse plane, the part or the segment is subdivided into superior and inferior subdivisions. Anatomical terms related to direction. These are examples of these terms. Anterior, it means that the part is towards the front, while posterior, it means that it is towards the back. Superficial, it means that the part is near to the surface, while deep, it means that it's away from the surface. Superior, it means that the segment or the part is located above, while inferior, it means that the part or the segment is located downward. Medial, it means that the part is located near to the midline, while lateral, it means that it is located away from the midline. In the linguists preferred to use other terms rather than medial and lateral. In the upper limb, we use radial, which refers to the side of the radius. the lateral bone of the forearm, and it means that it is towards the thumb side. The term ulnar means medial, or refers to the side of the ulna, the medial bone of the forearm, and it means that it is towards the little finger side. In the lower limb, tibial means medial, and it refers to the side of the tibia or towards the big toe side, while fibular refers to the side of the fibula, the lateral bone of the leg, and it means it is towards the little toe side. For other directions in both upper and lower limbs, these terms can be used. Proximal means it is near to the attachment of the limb to the trunk, while distal means it is away from the attachment of the limb to the trunk. Palmar, it means structures on the anterior aspect of the hand, while plantar means structures into the sole of the foot. Dorsum refers to the dorsal either of the hand or the foot. Anatomical terms related to movements. These terms describe the part of the body while moving. Examples are: flexion means bending of a joint, while extension means straightening of the joint. Abduction, it means that the part or the limb moves away from the midline, while adduction, it means that the part or the limb moves towards the midline. Circumduction is the summation of the previous movements, and it includes flexion, abduction, extension, and adduction. Rotation, it means that the part moves along an axis. It can be general or special rotation. General rotation, it occurs in most of the body joints, and it may be of the following: lateral rotation, and in this the part moves towards outside. Medial rotation or internal rotation, in this movement the part or the limb moves towards inside. In special rotation, it occurs in certain joints of the foot or the forearm and hand. It includes the following: supination, and in this movement the palm of the hand moves towards the front or upward. Pronation, in this movement the palm of the hand moves towards the back or facing downward. Eversion and inversion, and they are concerned with the sole of the foot. Eversion means that the sole of the foot is moving outside, while inversion means that the sole of the foot is moving inside. Terms of movement concerning fingers and toes. Abduction of fingers and toes, it means that spreading of them away from the long axis of the middle finger in the hand or the second toe in the foot. Adduction of the fingers and toes, it means that drawing them towards the middle finger in the hand or the second toe in the foot. Now we are going to shift to the second chapter, skin and fascia. Skin is the structure that covers the body and protects it from the environment. It's formed of two layers: superficial layer called the epidermis and a deep layer called dermis. Epidermis is the superficial layer of the skin. Over the palm of the hand and the sole of the foot, it is extremely thick, while in other areas of the body, like the anterior surface of the arm and forearm, it is thin. Dermis is the deep layer of the skin. It contains many blood vessels, lymphatics, and nerves. It shows considerable variation in thickness in different parts of the body, but it tends to be thinner on the anterior aspect than the posterior aspect. In female or in women, it is thinner than in males. Dermis is connected to the underlying deep fascia or bone by superficial fascia, which in other times it's called subcutaneous tissue. Skin lines. They are classified into flexural lines or skin creases, papillary ridges, wrinkle lines, languor or tension lines. Flexural line or skin creases are present over joints. As these lines, the skin becomes thinner than elsewhere, and it is attached to the underlying structures by strong bands of fibrous tissue. Papillary ridges, they are confined to palms and sole and the flexor surface of digits. They are in the form of narrow ridges separated by fine barrel grooves. Wrinkle lines, these are caused by contraction of the underlying muscles. On the face, they are known as line of expressions, and they become evident with aging due to loss of the skin elasticity. Langer lines or tension lines, they correspond to the orientation of collagen deposition in the dermis. During surgical incision, it is preferred to do the incision along Langer lines to avoid severe scar formation. Skin has many functions, such as protection of the underlying deep structures against infection or microorganisms. It also prevents fluid loss. It helps in regulation of the body temperature by secretions of sweat glands. It plays an important role in sensation by having receptors for pain or touch and temperature. Skin appendages, they are skin-associated structures. Examples of these appendages are nails, hair follicles, sebaceous, and sweat glands. Nails, they are characterized blades on the dorsal surface of the tips of the finger and toes. Parts of the nail include its root, which is the proximal edge of the blade, and the nail bed is the surface of the skin covered by the nail. There is a fold of skin that surrounds the nail except at the distal edge of the blade, and it's called nail folds. Hair is a derivative of the epidermis. It consists of two parts, hair follicle and hair shaft. Hair follicle, it is a sac from which the hair follicle grows. It functions to anchor the hair into the skin. It also receives the opening of the sebaceous glands. Hair shaft, it is the remaining part of the hair, and it consists of cortex and cuticle cells. In some types of hair, it contains medulla. Hair bulb, it is the concave base of the hair follicle, and this concavity is occupied by vascular hair papillae. Some areas in the body are devoid of hair. Examples of these are lips, palms of the hand, sides of the fingers, the soles and the side of the feet and the side of the toes, the gland penis in male and the clitoris in female, the labia minora and the internal surface of the labia majora in female. Sebaceous glands lie within the dermis, situated on the sloping undersurface of the hair follicle. Their secretion is called the sebum. Sebum, it is an oily material that oils the surface epidermis around the mouth of the follicle, and thus helping preservation of the flexibility of the emerging hair. This sebum is poured via the sebaceous gland on the shaft of the hairs. Sweat glands, they are long spiral tubular glands distributed over the surface of the body. These glands extend through the full thickness of the dermis and may extend into the superficial fascia. Therefore, they are the most deeply penetrating structures of all epidermal appendage. Some areas of the body don't contain sweat gland. Examples of these are the red margins of the lips, the nail beds, the gland penis, and the clitoris. The third topic in our lecture is about fascia. Fascia is a layer that lies between the skin and the underlying muscles and bone. It can be divided into two types, superficial fascia and deep fascia. Superficial fascia or subcutaneous tissue is a mixture of loose areolar and adipose tissue that unites the dermis of the skin to the underlying deep fascia. In certain regions such as the scalp, back of the neck, palms of the hand and the sole of the foot, it contains numerous bundles of collagen fibers that hold the skin firmly to the deep structures. In other regions such as the eyelid or auricle of the ear, penis and scrotum and the clitoris, it is devoid of adipose tissue. In the anterior abdominal wall, it can be differentiated into two layers, which are superficial fatty layer and deep membranous layer. Function of the superficial fascia is that it gives certain parts of the body their specific contour, as in the buttock and breast. It acts as heat insulator by prevention of excessive heat loss. It also acts as a source of energy during its contact of fat tissue. It acts as a medium for the passage of the cutaneous nerve and vessels to the underlying layers. The second layer of fascia is called the deep fascia. It is a membranous layer of connective tissue that invests the muscle and other deep structures. It has many functions. It holds the underlying tendon in position or acts as a police around which the tendon may move. It also invests the deep structures to bone. Some muscles may take their origin from the deep fascia or be inserted into it. It also sends septa to bone, forming compartment between different groups of muscles. It may be thickened to form structure called reticula, which hold the long tendons of muscle in position. In the region of the palm and the sole, it protects the underlying structures by forming palmar and plantar aponeurosis. Deep fascia in different regions of the body has different names and forms as follows. In the region of the neck, it's well defined, and this may play a role in determining the path taken by pathogenic organisms during infection. In the thorax and abdomen, it forms a thin film of areolar tissue covering muscles and aponeurosis, while in the limb, it forms a definite sheath around the muscles and other structures, and this holds them in place. Fibrous septa extend from the deep fascia, dividing the interior of the limb into compartments. In the region of the joint, it may be thickened to form restraining bands called reticula.